We did have one question come in that might be interesting, particularly for Tim to answer, but happy for Maria as well, is, you talked about whether someone with Mito meets the criteria for type 1 diabetes. So that suggests that when someone's got Mito and they get a diagnosis of diabetes, does that mean it could be any type of diabetes, or is there certain types of diabetes that are more likely to happen for someone with Mito?
Yeah. Well, I guess, diabetes is something which is not just clear cut. It's often multifactorial. And indeed, we used to think of type 1 and type 2 diabetes as being very distinct, but we've now learned over the last 20 to 30 years that there is quite a big overlap, and that same overlap can occur within those subgroup of patients with other conditions as well. So just because you have mitochondrial disease doesn't mean that you can't develop type 1 diabetes. So that's certainly a possibility. There is a typical trajectory, and I guess most people with mitochondrial disease would be more likely to develop what would be called type 2 diabetes, but it's very important in sort of monitoring and following things to be certain of that and to do appropriate testing to confirm that diagnosis. So I guess that's my perspective.
As a similar sort of question, we're getting lots of technical questions, is, other than kind of standard diabetes care, does diabetes for someone that has Mito, does that mean that there are additional kind of management guidelines or different things that you consider in their care that we should know about?
Well, I guess, the association of mitochondrial disease and lactic acidosis means that certain medications we would use in type 2 diabetes, like metformin, are generally very much avoided. But otherwise, we do know that people with mitochondrial disease tend to sort of be more affected by complications. So the things that we're talking about in terms of heart, kidney screening, very important that we stay on top of for those with mitochondrial disease. So they're just some of the things that we've got to think about, particularly in this particular space.
Cool. And there's another question that's come through to us, which is, this person says, I am borderline diabetic, so I'm particularly interested to hear, what should I be doing at this time? So I have Mito and I'm borderline diabetic. What could I be doing now to, slow down the progression of their disease in the direction of diabetes?
Yeah, well, I guess, from my perspective, it's dietary and lifestyle management is what's going to be the most beneficial for someone in that situation to focus upon. Without context, if you are carrying a bit of extra weight, some weight loss can be protective. It can improve insulin secretion and insulin sensitivity. So they're factors that are very important. So sometimes weight loss can be appropriate. Physical activity, I think most of the population, whether you have mitochondrial disease or not, is probably a little bit underactive. I'm guilty of that as well, but aiming to have 30 minutes of moderate intensity exercise at least 5 days a week, and then sort of being mindful of other sort of risk factors as well. So looking at cholesterol and blood pressure and sort of being proactive with your general health can be important.
Extra important, yeah. You listen to all the public health messages and then really listen to all the public health messages.
Yeah, for sure.
And I know exercise can be extra challenging for people with Mito, so I think sometimes it's probably also good to add on to that, to making sure that exercise is guided by an exercise physiologist or another exercise professional. I'm not a medical practitioner, but I'll add that in there. Would you agree, Tim and Maria?
Yeah, no, certainly we've got to take the individual into account, and certain factors. We can't just blanket sort of prescribe exercise without taking into account other factors. So irrespective, I do think it's sort of important that people do stay physically active. I think if you don't use it, you lose it sort of still applies. So we've just got to find the right level and intensity for the individual.
And it's also important to get a good exercise physiologist that understands the condition, is interested. And there's so many now out there that are, for instance, in diabetes, they understand. So depending on, for instance, if you have type 1 or type 2, the types of exercise that you do may put sugars up for a while and then drop down. So it's understanding the Mito condition, what that patient has, and they have somebody that can then prescribe, and help them sort out a little bit of exercise. I think with exercise physiologists always think, safety first, and I'd like to have somebody that knows what they're doing when this is not a blanket prescription, if you know what I mean.